So what is this low blood sugar level? So will we get this low blood sugar, that is decreased glucose in our blood? If yes, then when will we get this low blood sugar and how will we get this low blood sugar? And also, so what is the treatment? What we are supposed to do when our blood sugar level goes below normal? So normally our blood sugar level should be more than 70, that is 70 milligram per deciliter. So whenever we consume any food, the food will be having the nutrients. Some major component of this nutrient is the carbohydrate. This carbohydrate will be broken down into glucose and our body absorbs this glucose, and this glucose will be there, absorbed glucose will be there in our circulation, that is in the blood. So this glucose, our body cells keep using this glucose for the purpose of energy. Every cell of our body needs energy which will be provided through this glucose. So when we eat more carbohydrate, more glucose enters our circulation. So our body recognizes this high glucose and it stores, instead of utilizing it, it stores extra glucose in the form of fat. When we eat less carbohydrate, that is a less glucose than what we need, in such case it reduces, it keeps on reducing till 70 milligram per deciliter. So when it goes to the level or less than 70 milligram per deciliter, our body recognizes, each cell recognizes this and starts utilizing other than glucose, that is the glycogen from the liver and fat that is stored in our body as a source of energy. So mean to say, our body will not let the glucose to go below normal, that is below 70 milligram per deciliter. At that stage, our cells start utilizing, for the purpose of energy, they start utilizing the alternate source, that is the glycogen of liver and the fat in our body. This is what happens in a normal individual. That means to say, even if we are doing a fasting, not eating anything for 4 to 5 days also, our blood sugar level will be maintained. It doesn't go below 70 milligram per deciliter. So but if you are suffering from a diabetes and you are on medication, could be a tablet or could be an injection like insulin, in such case the medicine will be forcing the body to utilize this glucose. So more than the need, the medicine will be forcing these cells to utilize the glucose whatever there in our blood. Even when it goes below normal, below 70 milligram per deciliter, the medicine will be forcing the cells to utilize it. So it keeps on using this glucose, and then it may result in the hypoglycemia, that is a low sugar level. So low sugar we see only in a diabetic patients, those are on medication, could be on tablet or could be on insulin. So what are the clinical features, what are the symptoms, what are the presentations of a low sugar? So first thing, commonest feature what we see is the sweating, excessive sweating. So one thing. Second is a blurred vision. Third is a confusion. Fourth is irritability, then palpitation will be there, then nausea, vomiting. When the sugar level goes less than 40 or 30, then the patient may result in unconsciousness. The patient may develop unconsciousness. Then what is the treatment? Before the treatment, how to make out, how to diagnose this low sugar level? If you are having a glucometer at your home, then you can check. If you have these symptoms, you can check and look for this glucose level. But again, if you don't purchase glucometer for this purpose. If you are on insulin, better to have a glucometer at home. But if you are not on the insulin, just you are on a tablet, then it's not necessary to buy any glucometer. So if when you develop all these symptoms what I mentioned, in such case, if you don't have glucometer, then just take little bit of sugar, just consume little bit of sugar or a glucose powder. If the symptoms are due to the low sugar, then within a few minutes you will become normal. The symptoms will subside within a few minutes if you consume little bit of sugar also or even chocolate also. The low sugar is not because of less eating, but the low sugar is because of the medicines what you are consuming. The diabetes, anti-diabetic medicines, either tablet or insulin. So you are supposed to reduce the medicine. If you are developing low sugar level, then you are supposed to reduce the medicine instead of increasing the food. Generally what the people do, if they develop low sugar, then they start eating more. Even the doctors keep advising to eat more frequently, once in 2 hours or 3 hours, if you are suffering from diabetes and you are on medication. But my advice is, if you are diabetic, you are on medication and you are developing this low sugar symptoms, then you are supposed to reduce the dosage of medicine. If you are on insulin, then change it to tablet. And if you are on tablet, then keep on reducing the dosage of tablet. If the dosage of tablet itself is low, then stop completely. You can stop this medicine. This diabetes is not a lifetime disease. It's just a lifestyle disease. But doctors, for their survival, they call this as a lifetime disease, and they advise you to take more frequent food as well as more frequently tablets. For precise and scientific information about health, subscribe to our channel. Be happy, stay healthy. Namaste.